One of the big concerns with the COVID-19 pandemic is the rapid and surprisingly widespread of disinformation and misinformation about the nature of the problem, the nature of the virus, and the nature of the government response. And so beginning on March 16th, a team at Princeton University and in 10 countries around the world started collecting information on basically what were the misinformation narratives that we're seeing out there. And these are being collected in, right now, 20 different languages, including Urdu and Pashto, Tajik, Dari, Farsi, Arabic, Chinese, Spanish, French, German, and so on. And what we've been doing is we've been trying to understand what's the distribution of narratives that are out there about COVID-19, and how worried should we be about these disinformation narratives messing up the response to the pandemic. And so what I want to do is start by saying a few words about what the relevant social science tells us, whether we should be worried or not. And then I'll tell you a little bit about what we're seeing in the data, and then talk a little bit about recent events in the United States. So why should we be worried about misinformation related to COVID-19? Well, the reason to be worried is fundamentally that there's a trend in society over the last few years in which increasingly people are relying on the internet for health information. In the United States, 80% of adults go to the internet for health information, according to one study by the Pew Research Center, and that number has increased over the years since that study was released. That means that it's easy for people to find and access incorrect information about the COVID pandemic. And in the past, we've seen with other epidemics, particularly the Ebola epidemic in West Africa in 2014 to 2016, the casualty rates from the epidemic were correlated with misinformation. Areas that had more information circulating saw higher rates of casualties from Ebola. And in the United States, when children die from seasonal flu, which does happen at significant rates, it is almost always associated with the failure to vaccinate for that year's flu epidemic. And a lot of those vaccination failures come from people who have been consuming anti-vaccination propaganda. And we're not in a situation where we can rely on the social media platforms to take this stuff down, even though it's fairly easy to classify. So last week, the Oxford Internet Institute released a report in which they tracked a sample of 225 pieces of misinformation identified by fact checkers at First Draft News, which all the major platforms have access to. Much of that content was still up when they went to do an audit and look for it. 59% of it on Twitter, 27% on YouTube, and 24% on Facebook. So the platforms aren't yet taking all that information down, and we might be worried that people are susceptible to this information. So a number of scholars in the United States have noted that there's a strong difference in levels of social distancing as measured in cell phone data between places that are more consuming of media that is representing the right of our political spectrum, which tends to downplay the virus, or at least did early on in March, versus places where the media environment is more dominated by sources on the left side of our political environment, which took the virus very seriously early on. And in fact, there's some evidence from scholars at University of Chicago that the response to stay-at-home orders is stronger in the places that have kind of that left-wing media access than places that have that right-wing media access. So there's some reason to be concerned that people are susceptible to misinformation, and that it's going to get out there and it's going to reach people and it's going to damage the response. So that's why maybe you should be worried about COVID-related misinformation. Reasons why it's probably okay are that it turns out that in a number of studies, and my colleague at Princeton, Marcus Pryor, has did the pioneering work on this, if you give people small incentives to get the answer right on factual questions, that destroys many kinds of bias. So in the United States, we have this problem that when there is a Republican president, people on the right think the economy is better than it actually is, and people on the left think it's worse than it actually is, or at least they say so in surveys. And when there's a Democratic president, the opposite happens. The people on the left are happier with the economy than they should be, and the people on the right are more negative than they should be. Now, it turns out that if you give people a small payment for getting the answers correct about the economy, you kill that partisan bias. And what that means is, like, the one interpretation of that, I should say, is that the way in which people process information when they're doing these kind of knowledge surveys is partly about expressing their political views. And it doesn't take much of an incentive to get them to give that up and focus on reality. And in the context of COVID, where in different parts of the United States, you've had some of the highest fatality rates of anywhere in the world, the incentives to get the facts right about the virus are quite high. So you might expect that that kind of biased information processing would go down. And it turns out that in a number of places, small things which governments do to build trust in communities can actually dramatically improve engagement with health workers. So there's good evidence from Sierra Leone that pre-Ebola interventions, which created tighter community health worker ties, led to better responses to the epidemic. And from the Philippines, that programs which were intended to create ties to the central government for counterinsurgency purposes to help combat terrorist and insurgent groups have led to higher rates of reporting and response as the government goes out and seeks to collect information related to COVID. So there are things governments can do which seem to engage citizens and help with the response in even the worst circumstances. And in the United States, at least, it turns out that fake news exposure is actually quite low. A very small number of internet users see the vast majority of fake news. So in one study, 1% of Twitter users account for 80% of exposure to fake news on Twitter. And 0.1% of users, so 1/10 of that 1% who see it, are responsible for 80% of the sharing. So it's actually a small number of people who see it and an even smaller number of people who share it, who really engage with it. So that should all make us somewhat hopeful. So what does the COVID-19 disinformation environment look like around the world? Well, we've at this point tracked about 550 different narratives all around the world. They've been steadily increasing since mid-March. And they span a number of areas. So roughly 20% focus on the nature of the emergency response. They're like incorrect information about stay-at-home orders and things like that. Another approximately 20% have to do with either false diagnostic procedures or false cures and preventive measures. Then there's about 40%, which are about the nature of the virus. And these are things like, oh, it's no worse than the seasonal flu, or it's as infectious as measles, both of which are wrong. It's less infectious than measles, more dangerous than the seasonal flu. Or they are trying to create narratives that the COVID-19 is a designed organism. It's something that was weaponized either by China or by the United States, depending on who's pushing the narrative, and that it somehow got out of the lab and is out there damaging the world. So there's kind of like range of narratives. And then there's another 20% of the narratives out there, which are, miscellaneous things, stories about like the COVID-19 status of particular individuals that are incorrect. The motive for these is quite diverse. There's a substantial number, roughly a third, that seem to be directly trying to provoke fear in target populations. There's another third, which is what we could think of as classic internet trolling, in the sense of just trying to screw up the online discussion and kind of putting content in there for entertainment purposes. And then there's a smaller portion, maybe a sixth or 2/9, that are about politics. They're either trying to promote the quality of the response by particular individuals or denigrate institutions in particular countries for doing a poor job of responding. And then there's a very small portion, about 1/9 of the disinformation narratives that seem to be out there to make a dollar, make money. And these are things like silver will cure it, so buy our special solution that you can gargle with every day and then you'll be safe. Things like that. Of the people promoting the content, the most diverse set of stories is being promoted by individual actors. There's a small number of stories that are being promoted by state sponsors, primarily Russia and China, but also a number of other countries. And what those stories are is fortunately not things about the nature of the virus or trying to undermine the emergency response or screw up the response in different countries. What the state-sponsored narratives are about is about the origin of the virus. They're basically trying to seed particular narratives that will be politically useful later. And there is a long history of this. So during the AIDS epidemic, the Soviet Union ran a large disinformation campaign called Operation Infection, which actually placed scientific papers in a number of journals which falsely claimed that AIDS was a designed organism. And those narratives delayed the response to the AIDS epidemic by a number of years, according to some accounts, which led to certainly excess deaths. And they still circulate in parts of the world where people deny the severity of HIV and the need to follow safe sex practices to prevent transmission. So these things can be very problematic over the long run, but fortunately, the nation-state actors are not yet trying to promote false information, which would directly mess with the response. So what else are we seeing in the disinformation space? There are two other notable trends. The first is that a large number of these things are not being shared on channels where the platforms can take them down. Roughly 36% of the narratives that we've identified are spreading through chain messages, WhatsApp channels, and things like that, direct peer-to-peer communication. And so those are not things that content management algorithms can deal with. And the second is that there's been a very aggressive and extremely heartening response from the media and fact-checking organizations around the world. So several times a week, we find new websites which are focused on the media in different countries and debunking COVID-related myths in those countries. And so what we're seeing alongside this kind of explosion of disinformation related to COVID and misinformation is an explosion of fact-checkers who are working to discount this stuff and creating tremendous resources that any journalist could use to fact-check their COVID story, or any citizen who wants to know if the crazy thing their brother or their uncle or their cousin sent to them is true, can go and check the validity. So the ecosystem, the kind of civil society ecosystem, is responding to COVID-related disinformation. And if you combine that with the good news from social science that I expressed earlier, we maybe shouldn't be quite as nervous as some people are that this is going to really screw up the response to the pandemic. Now, what we're seeing in the last few days in the United States gives me kind of pause in coming to that hopeful conclusion. Because what we've seen in the last week or so in the United States is a coordinated campaign mobilized mostly on Facebook to generate real-world protests against protective measures. And that has led in a number of states, or at least correlates in a number of states, with governors starting to walk back protective measures, even as the rate of cases is still increasing in those states. And my concern with that is that what will happen is you will then see a resurgence in COVID spread in those states. And that is not going to be helpful for the public health response.